Well, I think the GP is absolutely critical because you are in a privileged position of seeing people and getting to know them so that you hopefully have a bit of an idea about their family history, you can understand what their goals and expectations are, and you've got opportunities of being able to pick up when there's something not quite right that the person's worried about. So I think that's really helpful. When you know people, you're better able to assess those subtleties, and you also hopefully have a relationship so that they trust you and your advice when you're recommending screening. I think you are dealing with a lot of chronic diseases, and so people come with their shopping list of things that they want to do, and many of those things are things that you can help a little bit but you can't really fix. So the patient has got their agenda and the GP has got their agenda, and in the time pressures and the funding arrangements are really not that conducive to including the screening in that. So if someone's coming along and they've got issues with abdominal pain or elderly relatives or things, they need to spend time on that. So it's really hard to fit in you really need to go and have a mammogram type conversation, and it may just not be sort of appropriate in that space. So I think it's about, just like we do for smoking, we just use every opportunity we have to say, by the way, how you going in that sense. I think there is that real opportunity to do it, but don't underestimate the challenges.
There was no one else who can do the role of general practice. There's no one else who can say what needs to be said to encourage people to look after their own health, to correct their misunderstandings, to correct what was being told to them in the past and is no longer accurate. I mean, general practice information has got all medical information has got a use-by date of about 2 to 5 years. And it happens for a variety of reasons. The first of all, because we learn more about the diagnosis and the illnesses themselves. The second thing is because there are new treatments available. And the third thing, which is most interesting, is that the diseases themselves actually change.
I think the role of the general practitioner and nurse cervical screeners in cervical cancer screening is really to identify those women who are in the appropriate age for screening and to offer it to them, but particularly to explain why it's important and what they're actually, what the test is looking for and how they will be followed up if it's negative or if it's positive. One of the most challenging would be actually keeping our practice records and data clean so that we can recognise in our patients who needs to be screened and offer it to them and who is up to date. So we are not offering inappropriate screening to our patients.